Hello, my friends. I'm Dr. Anna Schneider, your back pain warrior and guide with over 20 years of experience as a physician. If you're watching this, chances are your back has been screaming at you louder than a toddler who didn't get their nap. Chronic back pain, it's relentless, it's exhausting, and it can make you feel like your body's betrayed you. But here's the truth I've learned from decades in the trenches: you are stronger than your pain, and today, I'm handing you the tools to fight back. We're diving into the world of physical therapy techniques that I've seen transform lives, techniques that don't just mask the pain but empower you to reclaim your body. This isn't about quick fixes, it's about you stepping into the driver's seat of your health. So, grab a comfy spot, maybe a cup of tea, and let's get moving, because you deserve a life where pain doesn't call the shots. Stick with me, and let's do this together. Oh, and drop a comment below. Where are you watching from? Your city or country, I'd love to know. Let's start with the basics, because knowledge is power, and I want you to feel powerful. Chronic back pain isn't just a random ache, it's pain that sticks around for more than 3 months. It could be from an old injury, arthritis, poor posture, or even stress. Yes, your mind and body are more connected than you think. As a doctor, I've seen it all: the construction worker whose discs took a beating, the office hero hunched over a laptop, the mom lifting kids like a superhero. What unites them? The pain stole their freedom. But here's the good news: it doesn't have to stay that way. Your spine is this incredible masterpiece: 33 vertebrae, discs like shock absorbers, and muscles holding it all together. When something's off, say, a tight muscle or a slipped disc, it's like a domino effect. Pain signals fire up, and your brain goes, "Whoa, we've got a problem." For chronic pain, those signals get stuck on repeat. But physical therapy? It's like hitting the reset button. Now, I've got a question for you: what's your back pain story? How long have you been fighting it? Drop it in the comments, I'm here to listen. Understanding your pain is step 1 to beating it, so let's keep going. Here's what I tell my patients: your back isn't broken, it's just asking for help. Maybe your core's weak, or your hamstrings are tighter than a drum. Maybe you've been sitting so long your posture's yelling SOS. Over the years, I've seen physical therapy turn that SOS into a victory cheer. It's not about fancy equipment or magic pills, it's about teaching your body to heal itself. And trust me, your body wants to heal. It's been waiting for you to take charge. So, why does physical therapy work? Let's break it down like we're old friends chatting over coffee. First, it strengthens the muscles that support your spine, like your core, glutes, and back extensors. Think of them as your body's personal bodyguards. When they're weak, your spine takes the hit. Second, it improves flexibility. Stiff muscles pull on your back like a tug-of-war gone wrong. Physical therapy loosens that grip. Third, it retrains your brain. Chronic pain rewires how you move. You start guarding that sore spot, which makes things worse. Therapy teaches you to move fearlessly again. I've had patients come to me saying, "Dr. Anna, I can't even bend to tie my shoes." 6 weeks of targeted exercises later, they're dancing at their kid's wedding. That's not a miracle, that's science. Studies, and I pored over them, show physical therapy reduces pain by up to 50% for some folks. It's not overnight, but it's real. Here's a little secret from my years in practice: consistency beats intensity every time. You don't need to be a gym rat. You just need to show up for yourself, day after day. How does that sound to you? Are you ready to show up? Tell me in the comments, what's one thing you'd love to do again if your back pain eased up? See this? It's called a knee to chest stretch. Simple, right? But it's a game changer for tight lower backs. We'll get into more techniques soon, but this is proof: you don't need to be a pro athlete to start. You just need to believe in yourself. I believe in you, and I've seen what's possible. Alright, let's get to the good stuff, the techniques I've used with patients for decades. These are my go-tos, backed by science and real results. I'll walk you through each one like I'm right there with you. Ready to take back your power? Let's go. Technique 1, Knee to chest stretch. First up, the knee to chest stretch. Lie on your back, bring one knee toward your chest, hold for 20 seconds, then switch. Do this 5 times per side. It's like giving your lower back a big, warm hug, loosening those tight muscles and easing pressure on your spine. I've had patients swear by this for sciatica relief. Try it tonight. How does it feel? Let me know. Technique 2, cat-cow stretch. Next, the cat-cow stretch. On your hands and knees, arch your back up like a cat, then dip it down like a cow. Flow between them for 30 seconds. This wakes up your spine, boosts flexibility, and feels amazing. I've seen it help folks with stiffness from sitting all day. What's your daily routine like? Lots of sitting? Share below. Technique 3, bridge exercise. Dr. Anna lies on her back, lifting her hips. Now, the bridge. Lie flat, knees bent, feet on the ground. Lift your hips until your body's a straight line from knees to shoulders, hold for 5 seconds, then lower. Do 10 reps, this fires up your glutes and core, your spine's best friends. Weak glutes? Your back suffers. Strong glutes? You're unstoppable. Try it, what do you feel? Technique 4, bird dog. Here's the bird dog. On all fours, stretch one arm forward and the opposite leg back. Hold for 5 seconds, switch sides, 8 reps each. It's a balance challenge that builds core stability. I've seen it work wonders for posture. How's your balance? Give it a shot and tell me. Technique 5, pelvic tilt. Dr. Anna lies on her back, explaining gently. Last one for now, the pelvic tilt. Lie down, tighten your abs to press your lower back into the floor, hold for 5 seconds, relax. Repeat 10 times. It's subtle but strengthens your deep core muscles. Perfect for anyone who's been told they have a flat back or lumbar issues. How does your back feel after this? These aren't just exercises, they're your ticket to freedom. Start slow, listen to your body, and if something hurts, stop and check with a pro. I've seen these moves change lives, and I know they can change yours. Which one are you excited to try? Drop it below, I'm cheering you on. Here's where we tie it all together. Technique is great, but success? That's about you, your grit, your heart. Tip 1, consistency. 5 minutes a day beats an hour once a week. Tip 2, mindset. Pain can make you feel small, but you're not. You're a warrior reclaiming your body. Tip 3, track your wins. Can you stand longer? Bend easier? Celebrate that. I've had patients who started with tears and ended with triumphs. One woman, she'd given up gardening, came back a year later with photos of her roses. That's what's waiting for you. So, what's your rose garden? What's that thing you're fighting to get back? Share it, I want to hear your dreams. My friends, you've got this. Chronic back pain doesn't define you, you define it. These techniques are your tools, but you're the hero of this story. Start small, stay steady, and watch your strength grow. I've seen it happen, and I can't wait to hear your victories. Drop a comment, where are you watching from? Your city, your country? And tell me, which technique are you trying first? How's your back feeling today? Let's keep this conversation going, I'm here for you. If you found this helpful, give it a thumbs up, share it with someone who needs it, and subscribe for more. Together, we're building a community of back pain warriors. I'll see you in the next one. Keep fighting, keep shining,